I'm Brad Carofino. I'm a shoulder and upper extremity specialist at Atlantic Orthopedics. A large portion of my clinical practice is related to complex shoulder surgeries and reconstructive operations such as shoulder replacement. One of the things that I think that we do really well here at AOS is shoulder replacement surgery. And in fact, my partner, Dr. Chad Mankey, and I have developed a center of excellence around this. I feel that we've brought together all the critical components to deliver the highest level of patient care. We have a clinical research team, we strive to provide the highest care possible, and we're constantly introducing new technologies in shoulder replacement. I think the biggest reflection of the level of care that we're providing here is the clinical volume that we see. Patients come to us from throughout the region and even from other parts of the country for their shoulder replacement surgery. Currently, between Dr. Mankey and myself, we're doing 200 to 250 replacements per year. And that's certainly the highest in the Hampton Roads area and really puts us on a national level. So we feel that we're, based on that experience, that we're able to deliver the highest level of care possible to our patients. Today I'm going to talk to you about one of those technologies, and that's the Exactech GPS program. GPS technology essentially allows us to do computer-navigated surgery to make sure that we get the implant exactly where we want it to be. And that process first starts by getting a CAT scan of the patient's shoulder. Based on that CAT scan, we can build a shoulder, a model of the individual patient's shoulder. And so if you look at the computer program here, you can see the patient's scapula, their bone, which has been reconstructed from their CAT scan. And we can actually manipulate this image. We can spin it any way that we want so that we can get a full understanding of what their bone shape is like. Once we have that, we can then use the simulation to decide where we want the implant to be. So you can see the glenoid base plate, which is in blue here, and I can use the computer software to change the position of where it sits. So here I'm placing it lower. I wouldn't want it to be there, but I'm just showing how I can manipulate that. I can place it higher. I can place it deeper into the bone. So I can play with this in a lot of different ways to make sure that I have a full understanding of the patient's anatomy, and also to make sure that I have a plan so that it's going to be positioned perfectly. And then once we have that plan, we lock it in, and we take that to the operating room. Okay, so if you can imagine we were in an operating room here, this is what we would have set up. So this is the patient's shoulder. We have essentially a tracking device that gets attached to one of the bones. And then based on that, we can match up the patient's actual shoulder with the computer simulation that we have. And the first thing that we're going to do, and this is, we're going to demonstrate how we would put in a reverse replacement here. The first thing that we're going to do is make sure that we have our center hole starting point exactly where we want it. So you can see that the computer simulation has marked out in blue where we want our center hole to be. So now we have a guide on the drill that I'm using, and that is going to make sure that I put my drill exactly on that hole. And now I need to make sure that I'm drilling at the right angle, and you're going to see a bullseye come into view. And when I'm centered, that's where I want to be. Okay, so that's how we would drill our center hole. This is a reamer. Basically, this instrument will be used to make the bone flat so that the implant will sit on it nicely. And same thing, we're going to put this in the hole that we previously made. And now you can see that bullseye, and we can move this around. This is going to show us exactly the position that we want to be in as we ream. So that's how we'll make sure that we're doing this perfectly. And the simulations will show us what we're doing in real time. After we've prepared the glenoid, we're now going to place the implant. This is a glenoid base plate for reverse replacement. We've prepared the center hole. We've used the GPS to make sure that's in a perfect position. We've reshaped the glenoid so that it's nice and flat so that it fits perfectly with our implant. And then after we've done that, we'll just place that. The last thing that I wanted to show you about the GPS technology is how we can use it to watch where we're placing the screws. So we've placed our base plate, and now this is going to be fixed into the shoulder blade with some additional screws to make it nice and stable. And those screws work best if they're really positioned nicely in the bone. And sometimes that's difficult to do. But if we use the GPS, we can see on the patient's shoulder blade here where these screws are going to be aimed. And we can use this to make sure that it's going to be going right down the bone and get good fixation. So, and now you can see as the drill goes in real time. After we've put in our implant where we want it, the last thing that we do for a reverse is that we put on the glenosphere, which is the metal ball, and that just gets secured onto the base plate. So that basically shows how the GPS technology can be used to make sure that we're getting our implant in the perfect position.
I'm Dr. Chad Mankey with Atlantic Orthopedic Specialists. In today's age, with ever more complex shoulder replacements, having the tools to do your job is important. For me, these tools include a nice array of shoulder replacement options, as well as the ability to use navigation to be able to implant these complex implants into a shoulder that sometimes has a significant amount of deformity. For these patients with significant deformity, this navigation tool really does help with ensuring that these implants are properly placed.